As far as the ESMO meeting was very, very exciting. There's a lot of great data that was presented at the ESMO meeting. I think when I look at the data that's presenting, really a recurrent theme is looking at the PARP data in ovarian cancer. We presented the longer-term follow-up of SOLO-1. They presented a longer-term follow-up of PAOLA, the study, and they also presented the overall survival data from ARIEL-4. You know, I think we're coming to a crossroads now with PARP inhibitors. In my practice, I use them all the time. I think they work. I think women with ovarian cancer really sort of deserve a PARP inhibitor therapy in order to help them live longer. The challenge is that these some sort of post hoc, non-analytical evaluations of overall survival have suggested that there may be a detrimental effect on overall survival if treated with a PARP. I think it's not the right way to look at the data. When we look at the data, there's a tremendous amount of crossover in the trials, meaning that those patients who are initially randomized not to receive PARP therapy eventually do. Now, in that setting, as you can imagine, the overall survival differences aren't as great because they're all getting the same therapy. Ovarian cancer is a disease that we have to treat longitudinally, not just this line of therapy, but how will this line affect the next line, which affects the next line. And in those three presentations, SOLO-1, PAOLA, and ARIEL-4, I think it really sort of helped to further raise the question that we need to answer, and that is there any good reason why we should withhold this care from our patients?